Hi, I'm Robin Newhouse, University of Maryland School of Nursing. I was appointed to the Methodology Committee and now serve as chair. I want to start just by doing a Cliff Note version. If you don't hear anything else, I want to talk about how important nursing science is to PCORI. Number one, if you think about what we do as nurse scientists, we build the foundation through our science for clinical practice, and PCORI is interested in producing dependable information that can be rapidly translated to practice. Second, our nursing science focuses on prevention of disease and disability. PCORI is interested in producing evidence that helps people make decisions about prevention of disease and disability and selections of the treatments that they should take. Third, we create evidence related to managing and eliminating symptoms. And PCORI is interested in funding studies that improve outcomes that people care about. So I just want to start there by saying if you haven't looked at PCORI funding at this time, you should, because there's high synergy with what we do. So what kind of research does PCORI fund? First of all, it's comparative clinical effectiveness research. So it involves two comparators. It's evaluating the benefits and harms of intervention and strategies, but here's the important thing, in real-world settings, so it is effectiveness research. It adheres to PCORI methodology standards, and it's based on health outcomes that are meaningful to people. The other catch is it engages people and stakeholders in every stage of generating the question, selecting the approaches we use, and the outcomes that we use in our research. It's also highly likely to improve current clinical practice. The types of conditions PCORI is interested in are conditions that affect large number of people, so we can make a big difference in the care they receive and the outcomes that the care produces. The conditions place a heavy burden on individuals, families, and populations. We also study rare diseases. The populations of interest are racial and ethnic minorities, older adults, low-income and rural populations, and children. There are two funding streams, really three, but I'm going to talk about two in terms of investigator-submitted proposals. The first is around 5 national priorities. The first priority is assessment of prevention, diagnosis, and treatment options. The second, improving health system outcomes or healthcare systems. The third is communication and dissemination research. The fourth is addressing disparities, and the fifth is accelerating patient-centered outcomes research and methodological research. But we also focus on very targeted funding announcements. And the number of targeted funding announcements are because formed advisory panels on a number of conditions and each one of their major priorities. And the advisory panels had identified areas where there are major gaps where PCORI could make a difference if studies were funded. So you can see just a couple of the examples of the targeted funding announcements that have already been funded. Assessment, prevention, treatment, diagnosis, the options around selection of choices for uterine fibroids. In health systems, a transitional care study has been funded, as well as falls prevention strategy. So, and I won't go through each one of them, but as the advisory committees that are made up of patients and stakeholders inform PCORI about what should be funded, you'll see some additional funding announcements emerge. So you'll start to see more targeted funding announcements. And also, I'd like to make the point that many of these are in coordination with other funders. So in partnership with Agency for Healthcare Research and Quality and National Institute of Health. So the two that are starred here are administered with National Institute of Aging, and the uterine fibroids is in coordination with ARC. So the proposal review goes through a scientific review, just like other proposals with other funders, but there are a couple different criteria that you would have to consider when applying to PCORI funding. First of all, the impact of the condition on individuals and populations you're familiar with, I'm sure. The potential of the study to improve health outcomes and health systems, you probably are familiar with that. Technical merit as well. But the last two, the patient-centeredness of the proposal and the need for patient engagement throughout the trajectory of conceptualizing to actually translating the evidence to practice, has to be evident in the proposals. The other thing that's different about the PCORI review is not only do scientists review your proposals, but there's a patient that reviews your proposal and there's a stakeholder that reviews your proposal. And the reviews are based on their synthesis. And the other thing you should know is that once it goes through the scientific review and it's selected for funding, the PCORI Board of Governors makes the funding decision. So that's public. You can watch the funding decisions and the release of information about whether you were funded. And board meeting was Tuesday, and the pragmatic trials were announced. Very exciting, $64.1 million in pragmatic trials that will affect clinical decisions soon. Okay, so this whole aspect of patient-centeredness and patient-stakeholder engagement. So the patient-centeredness aspect, does it examine those questions that really affect a patient's preference? And the outcomes should reflect what outcomes are most important to the patient. So not just us selecting outcomes that are important to our science, but it has to be established and endorsed by patient feedback. And then stakeholder engagement. How have we engaged those patients and stakeholders in generating our research questions and selecting the designs that we use, in the methods that we use to measure, and what outcomes we measure as well? In addition, the proposals need to comply and include how you'll address each one of the methodology standards. These methodology standards are areas where the methodology, not that we know a lot about, not that we know nothing about, but areas where it would strengthen the proposal if in fact these methodology standards were endorsed. So there are currently 11 broad categories. They need to be incorporated into your proposal. We're working on 2 new methodology standards, one on designs with clusters and the second with complex interventions, which many of us conduct. So just a little snapshot for you about where the PCORI funding is allocated. This was as September and needs to be updated. You can see there are 39 states plus DC and Quebec that have received funding. And then this exciting initiative around large pragmatic trials. And as I mentioned, the first set of pragmatic trials were released Tuesday at the board meeting, and these are about $90 million that are available per cycle, a duration of about 5 years, and maximum direct cost of $10 million. So just to give you an idea, there were over 200 letters of intent. So in this mechanism, you submit a letter of intent. You're invited to submit a full proposal. There were 40 invited, 35 submitted, and 5 were funded on Tuesday. The other funding mechanism that PCORI has invested in, and this came up very clearly within the first year and a half, 2 years of PCORI existence, was the need for an extended network of clinicians to be able to advance the science, not only of observational studies, but prepare us to be able to conduct very rapid clinical trials. So PCORNet was funded, and the idea is that these funding initiatives will enhance the ability to collect data very quickly about phenomena that are of importance. So 11 clinical data networks, 18 patient-powered networks, and a coordinating center was funded. $76.8 million in the clinical data networks, $16.8 million in patient-powered network. Very innovative. The patients are driving these networks. It's wonderful. And then the coordinating center to manage these. Here's our cycle. And then, of course, the targeted proposals, you'll have to look for those funding announcements. And just to give you some information, here is the PCORI website. I also will answer any questions after we finish the session, but I just want to quickly ask you to raise your hand if you have PCORI funding. Awesome. Raise your hand if you're a PCORI reviewer. Raise your hand if you're on an advisory council. Keep your hands up. Okay, so if you just look around, you'll make sure to talk to these people because they know the inside of what's happening here, right? And they know the proposal, so make sure you talk to them. How many people would like to submit to PCORI? I was like, oh, right. All right, my job is done. Thank you.